Hello, everyone. My name is Caroline Clark, and I'm the Engagement Manager at Iowa PBS. Thank you all for joining us tonight for our pop-up film series featuring blood sugar rising in recognition of Diabetes Awareness Month. So the first 30 minutes of the program Blood Sugar Rising really set the stage for our virtual event. And we are now joined by 4 very special guests to give us some insight on diabetes education and management, what's going on with diabetes here in Iowa, and to answer your questions. So joining us live we're joined by corporate Hy-Vee dietitian Ann Cundiff, Melissa Batt, nurse practitioner with MercyOne Des Moines Diabetes and Endocrinology Care, Dr. Jamie Pitlick, associate professor of pharmacy practice at Drake University, and Rich Wells, Community Board President for JDRF Greater Iowa. Thank you all so much for joining us tonight. Reminder to attendees, if we'd love to hear from you, so if you have any questions, just feel free to type them in the chat and we'll present them so we can have an interactive conversation tonight. But let's jump right in with some questions related to the stories that we just watched. In the beginning of the film, we meet Montiel, and it's clear there are some systemic forces that play a role in his diabetes diagnosis. They mentioned a few things and gave a great story from him. So Dr. Pitlick, would you take that question? What are some of those burdens or challenges that he faced?
Yeah, I think as I watched his story, a couple of things popped out at me. Where he's living, and definitely in an urban area where he may not have access to as much fresh foods and some bigger grocery stores, so he can get some of those fresh foods is definitely. And another one I think that popped out was that lack of primary care. Where he had very little health care to screen for diabetes and get it caught early, so that by the time he had it, his blood sugars were very, very elevated.
Yeah, they made mention, I think, that they were surprised he was walking. And I know we've heard other stories about typically if someone doesn't know they have diabetes, they may go into a diabetic coma, which would be probably quite dangerous. Yeah.
One thing I found unique and interesting about his story, he doesn't fit the typical build of what we would consider for a type 2 diabetic. And so I appreciate that they chose him as a person to highlight, because I think it's very easy for us inside and outside of the medical community to attribute type 2 diabetes to overweight and obesity, which it is strongly linked. But when we hear about his story, the way he was raised, the economic hardships that his family underwent, they're eating bread with syrup, right? And so his body from a young age, it's just flooded and inundated with sugar. So I feel like his story kind of helped to dispel the myth that if you're type 2 diabetic, you have to be of a certain weight.
Yeah, I caught that too. I thought that was I thought his story, you can watch the full 2-hour film on the PBS video app, and his story, you can finish watching that. So the next person that we meet in the film is Nicole, and she talks about her experience being diagnosed with type 1. And I know that's a little different, Rich, from she was diagnosed as a teenager, but she experienced quite a few complications later on. And Rich, you have type 1 diabetes, is that?
That's right. Yeah, that's right. I was diagnosed a little bit later in life. I was 29 years old. So that's one thing they're seeing now with a lot of type 1s. It was sort of alluded to or mentioned that they're seeing an increase in T1D or type 1 diagnosis as well, which, type 1 is an autoimmune disease and different than type 2. But I think she did a really nice job of talking about the negative outcomes, right? That if it's not controlled, you don't control your numbers, you can lose your vision, your kidneys can fail, other organs can fail. It can be obviously a very, very bad outcome, whether it's type 1 or type 2. So I thought she did a nice job. The other thing I would highlight with both stories We talked about access, and that's something that JDRF is really focused on. I know ADA, American Diabetes Association, is as well too, but just having access to affordable insulin. Insulin is really like to a diabetic, especially a type 1, it's like oxygen. You know, if you do not have insulin, if I don't take insulin, I'm fortunate that I'm on an insulin pump. I have a sensor, I wear a sensor, it talks to the pump. And I'm very fortunate to have this technology that's come out now that automatically checks my sugar and doses me when I need it. And you don't have to prick your finger as much as you might without that technology. But not everybody has access to that type of technology, and not everybody even has access to affordable insulin, which is kind of is really sad and not good. So I think that was one thing that I heard as well too, is just having access, but then also taking it seriously. And I think that's what her story highlighted was kind of bringing that it's not a solo sport. I learned that very, very quickly. This is a team sport. Your family, even your coworkers, the great medical teams that are around you. It feels like a part-time job, sometimes a full-time job, but it's one that you have to really take seriously and make sure that you stay up on it all the time.
Yeah, it sounds like she really wished she maybe had taken it more seriously or had rallied around the right support group. So the last story that we hear from in that just first 30 minutes we see of the film is in Ohio. And so they were talking about how culture and heritage come into play, and just the conversation and question about how can communities still maintain their cultural relationship with food while still working to address diabetes. Anne, do you have some advice on that?
Absolutely. As a dietitian, we always try to still keep heritage and culture part of their food. We don't like to take that away, because once we start taking that away, then we go to the opposite end. Then we crave it, we want it more, and it creates more of a bad relationship with food. So we always want to maintain a good, healthy relationship, and then just talk about how can we still incorporate those foods, but still have them in moderation, in portion control, and in balance with the rest of the types of foods that they have access to and that they enjoy. So not taking things away, keeping them present, but then just talking more about portion control and balance with all the food groups with their types of foods that they like to eat.
Yeah, awesome. Good advice. That kind of leads into the next question, which Melissa, I would love to hear from you. We talked a little bit about what are the ways, or what are the things that you do to encourage and support your patients that are following a specific treatment plan? So what are some things that you can do that you do as a medical professional, but maybe what others can do as family members?
Yeah, absolutely. I think, a few of the stories, Nicole's especially, really alluded to this is a relentless chronic disease, whether we're talking about type 1 or type 2. And so I think the first thing is to understand the burden that these patients are under, the fact that they don't get to do anything without thinking about their blood sugar. And I think time of diagnosis is also really critical. I work in an endocrinology practice and care for mostly type 1 and type 2 patients. And I find that those who are diagnosed in kind of late adolescence, early adulthood, similar to when Nicole was diagnosed, seems to be a time that especially is challenging for them. And so my goal is to come alongside, be a partner with them. I love what Rich said. I tell my patients, this is a team sport. You do not do this individually. And so we have a good amount of support at the clinic. We have certified diabetes educators. We have our dietitians. We try to really pull together, bring family into the mix. Technology has done a wonderful job of allowing families to be more present in management as well. And so I think just letting them know that this is something we will have to deal with, day in and day out, but there are resources and tools. We have some counselors that we work with who specialize in working with diabetic patients and trying to get them access and support they need for any of the barriers that they may be encountering.
Yeah, that's great. I know that I think others might have some you talked a little bit about resources. So the question I'd like to ask all of you also to answer, if you have something to share, what other support services, you mentioned counselors, what else is available here in our community for either family members or those who have diabetes themselves?
One of the- Sorry, I was going to say one of the things Rich mentioned earlier was that access to medicine. And at Iowa Diabetes, where I have my practice site, we have a free clinic. And so working with many patients to get them the resources, to get them the medicines that they can treat. There are some really good, amazing online support systems through the drug companies to get insulin as low as either free or as low as $35 a month. And so working with your primary care doctor, your endocrinologist, your diabetes educator, whoever it is, to get access to those programs so that you're not rationing your medicines so that you can take care of yourself. Just asking for that help. We're all out there to help you.
Yeah, I think that is so important. There's if you watch the full episode, which I would recommend everyone do, there's a really sad story that is, unfortunately, it's not that uncommon. That is exactly that you saw a young man who had type 1, had just rolled off of his parents' insurance. I think he was 26, 27 years old, something like that, was trying to be independent, went to go pick up his insulin, and I forgot the exact cost, but it was insane. It was like $1,500, right? He couldn't pay that. Most people couldn't pay that. And so then he started rationing his insulin. He ended up dying. And so that is just not okay for that to happen. And so there's a lot, not to get political because we won't do that, but advocacy, I think, is really important too. And making sure that we let our elected officials know how important something like insulin is, that it's like water, it's like oxygen. And you shouldn't have to pay $1,500 to get insulin and then have to ration it. That's just not okay. So, but there is a bill going through Congress called the Insulin Affordability Act. And that's something you can learn about. We have some good links, both from a JDRF perspective, also the ADA site, American Diabetes Association, has really good information if you want to learn more about that. And then they make it really easy. They have some nice advocacy links you can click through and even contact your elected officials if you want to reach out to them.
Awesome.
Let them know your thoughts.
Yeah, thanks, Rich. I know Darla will, she has access to those links, so she can share those in the chat for those of you watching. Ann or Melissa?
Sure, I would love to share. So being a corporate Hy-Vee dietitian, we get to chat with people in the grocery store where food means the most. And we have some great free resources that we can offer across all states in America. So we have what we call our nutrition store tour, and that is a free diabetes store tour where we kind of virtually take you around the grocery store and help you pick out foods that would be a little bit better in interest of your blood sugars and just long-term to keep your diabetes under control. We also currently have some great cooking classes online that are free during Diabetes Month, which is November. And then we also are offering free A1C testing in our 8 states currently with our dietitian. So each November and also throughout the year, we try to offer some free diabetes programming that we can reach all kinds of people everywhere across the state and everywhere across the United States virtually. And if you ever want to meet with a dietitian, we do offer a free discovery session, and we can do that virtually. So we can give you some good basics about good nutrition or just answer some of your questions about nutrition for free. So it's a great access to all of us.
And on that too, again, I'm not going to give a shameless plug to Hy-Vee. He does an awesome job as a diabetic. And when you're looking for specific foods or you need your glucose tablets or whatever, most Hy-Vee stores do a really nice job of putting everything in one place. So it's just a nice, easy place to go. Other stores do the same thing. The other thing I would say too, and this sounds kind of strange, but I would say in many ways, it's a great time to be a diabetic because there are so many resources if you take advantage of those. Also, when you go to restaurants, most restaurants now, you can either use a cool app to find out exactly what you're eating, how many carbs, how many calories are in the food that you're eating. And so it's really just about taking the time to educate yourself on what, what you're putting into your mouth, the impact that exercise has, all of that. So there's so many really good resources in tools and technologies. And the last little thing I'll say too is really exciting work from a type 1 perspective on cell therapies. And there's so much more you can read about that online too. But it's just, there's just a lot of really interesting and exciting research underway right now. That's very, very exciting for not only type 1, but other autoimmune diseases.
Awesome. Thank you all so much. Those were all really lots of great resources. There is one question we had earlier on from someone joining us tonight, and I'm not familiar at all, so I'm going to just read. They had shared, Dr. Neil Bernard said in regard to type 2 diabetes, carbohydrates are not the culprit, fat is the culprit. So he preaches that fat prevents the insulin from getting into the cells and doing its job. Is that true? False? Melissa, maybe?
Yeah, so I'm not familiar with his work in particular. I hope I'm understanding the question correctly. When we talk about diabetes, there's type 1 versus type 2. Type 1 is an autoimmune disease, so you have to have a predisposed individual. And then there's an unknown trigger, whether it's environment, virus, something of that nature that causes the body to attack the cells in the pancreas inappropriately. It doesn't allow the pancreas to secrete insulin. So that's type 1. When we talk about type 2, it is multifactorial in terms of what leads a person to be type 2. And they alluded to that in the film as well. So overweight and obesity are a big culprit because what it causes is insulin resistance. So two of the what we call core defects in type 2 diabetes are inadequate insulin production. So your pancreas may still be making insulin, but just not enough of it. And then insulin resistance. So excess body fat, particularly in the abdominal area, so it depends upon where the excess fat is distributed as well, can lead the body to not be able to use the insulin as effectively. And again, they talked about in the film, insulin is the key. So if we don't have a key to open the cells and move sugar in, that's the challenge. Now, carbohydrates still play a central role when we talk about diabetes. They are what our body breaks down to sugar. So we know the things that are high in sugar, candy, cake, cupcake, right? Those things are pretty easy to know. But refined carbohydrates, pasta, bread, our body breaks that down to sugar as well relatively quickly. And that's what causes our blood sugars to spike and then typically drop after that. So I'm not familiar with his work specifically, if any of the other panelists are.
No.
No.
That was great. That I think answered the question for sure. That was perfect. A couple of questions from the audience. One, can your PCP handle your diabetes well, or should all diabetics see an endocrinologist?
Well, I'm biased. I work in an endocrinology office, right? So I think you should all come and see us. I think there are a lot of PCPs who are very well versed and very able to manage diabetes effectively. I think things to consider of, gosh, should I be referred to somebody else? Do you have a persistently high A1C? Remember, the A1C is that 3-month average of what your blood sugars are running. So if you have persistently poor control, that might be a consideration for a referral. If you are wanting access to technology that maybe your PCP is not familiar with or doesn't offer, we talk about insulin pumps, glucose sensors. Those are things that in endocrine we can offer fairly easily. And then in terms of type 1, I would say you can be better served by an endocrinologist with that as well. I think it comes down to the patient, how comfortable they are, how comfortable the PCP is. And if you're meeting your goals where you are, then you could probably stay with that provider. But sometimes, patients will benefit from maybe just a one-time consult, or maybe they follow with us for a short time. We get them under control, they're stable, and then they transition back. So it's really an individualized basis.
I would add on whether that PCP or the doctor has access to diabetes educators, dietitians, and those support staff for as well. If they are I know some internal medicine doctors that have access to that and can take really good care, but for sure endocrinology offices are going to have those support personnel that can really help give education to the patients.
Awesome.
I was just going to add, and again, I guess I'm giving another TV commercial here for IDEC, but I go to Iowa Diabetes and Endocrinology, great team. And that's exactly right. That what I find most valuable as a patient is having the educators. When there's new technology coming out, they're always right on top of it. And I can compare, do I want Medtronic or Dexcom or whatever type of device I may have. I mean, if you think it's tough to get a new iPhone, it's amazing. I mean, how new technologies keep rolling out. It's very exciting. It can also be overwhelming, and so it's good to have that team available. That's all they do is they focus on endocrine stuff, and so that's helpful for me.
Awesome. Lots of good options. Well, there's a few questions that I'm going to lightning round to recap. Rich, one person is asking, what was the app that you were talking about that can help when you're eating out?
Yeah, it's a great question. We use one called, you pay for it. And so there are a lot of free apps you can use too.
Okay.
But Zoom is one that is pretty popular, and you can even just use your phone and scan like the barcode, and it will tell you exactly kind of what the calories and everything that you're eating are. But there's a lot of apps you can pay for. There's some that are free. And so there's a wide variety if you go out and search on the internet.
And what was that name again, Rich?
Noom.
Noom.
Yes. Noom. But again, you pay for that.
Sure.
But there's some, and again, we have a lot of experts on the
Yeah.
other suggestions. But there's quite a few that you can use.
Yeah, I'll add, we recommend one website, mycalorieking.com, and then MyFitnessPal is a free app that we'll recommend as well.
That's what we usually recommend too. Hy-Vee also has an app for, it's called Healthy, and it actually sends us messages. So if our patients want to send us a picture of their food and ask for some feedback, it's completely free. And we'd be happy to give them some feedback about what they're eating on. So it's not actually, it doesn't give you a calorie amount, but if they do want some feedback from a dietitian, we can actually add real-time feedback during that picture.
Wow. That's pretty cool, Anne. One person was asking a question, is that virtual tour that you suggested, that's on Hy-Vee's website?
Yes, it's at Hy-Vee.com/health. And I think we were going to put the link in there as well on the chat, but they can just go to the Hy-Vee dietitian site on Hy-Vee.com. And then there will be the list of all the different tours that we have. We have diabetes, we have heart health. So if there's some other issues that people have, there'll be some other options too.
Perfect. There's a few questions we've had prior to our screening tonight, but some folks were asking, why is it okay to eat fruit when it's full of carbohydrates, and are some better than others? So Melissa talked a little bit how, the body breaks down the sugars. So the question about fruits and, is there a fruit that's the better fruit than another fruit? And also the question of, can I get rid of type 2 diabetes if I stop eating carbs?
I'll take the fruit question. So I always tell people fruit is nature's candy. You get lots of vitamins and minerals from fruit. You get fiber. Obviously, you can't eat buckets of fruit because in excess is never great. But I always say whatever fruit you like to eat, that's the ones you should be eating. And there's not one that's better than the others. There are some that have a little bit more fiber. But again, if you're testing your blood sugars and you're kind of seeing how foods are working for you, that's where you can find the fruits that work best with your chemistry too. And so I like to help people navigate that with testing their blood sugars and seeing how they're feeling, how they're reacting based on the types of foods that they're eating. And it's always good to eat fruit with a protein buddy. So you want to have some protein when you have some fruit, because that helps balance out that little bit of fruit sugar that's in the fruit.
I can speak to the second half of it. Was the question, can I reverse type 2 diabetes if I stop eating carbohydrates?
Yeah.
Did I hear that correctly?
Yeah. Can I cure my type 2 diabetes if
Yeah.
I stop eating carbs?
Okay. I mean, the short answer is maybe. It depends. It depends upon how far into the disease you are. You know, diabetes is a progressive disease. In the film, they alluded to the fact that you can have been diabetic for 10, 15 plus years before you're seeing any symptoms and you know. So I have absolutely had patients who have made excellent changes from a lifestyle standpoint. They have, you know, significantly reduced carbohydrates and sugar in their diet. They've worked really hard towards exercise goals. They've maintained a healthy weight, and they have been able to fully come off of all of their diabetic medications and maintain just with diet. So it's absolutely possible. I think the challenge is that diabetes is an aggressive, progressive disease. And so that's not typically feasible, but that's certainly the goal that we aim towards. Can we get you off of your medications, or can we at least reduce them to a point that you're not requiring as much?
Wow, I did not know that. So that is interesting to know about type 2. The opposite with type 1, correct? Because type 1 is
Correct.
an autoimmune disease. Perfect.
Mm-hmm.
Well, one person is asking specifically about their diabetes, and they mentioned they work hard to keep an average blood sugar low, but they rarely get it below 125. Their PCP is very happy with that, but shouldn't we be striving for more between 90 and 100?
Yeah, so it depends upon when are we checking glucose. So glucose is very dynamic throughout the day, and it depends upon where we're testing in terms of where our goals are. So depending on the guidelines that you look at, our goal for fasting blood sugar, so that's first thing in the morning on an empty stomach, we want you to be between about 80 and 120 is what we're aiming for. Now, this is assuming that you are a non-pregnant individual. Pregnant individuals, we have more aggressive goals. If we're looking post-meal, 2 hours after a meal, we want you less than 180. Before bed, typically less than 150. But if we're looking at an average, remember that A1C is our gold standard. It tells us over 3 months what your sugars have been running. And the goal for most patients is an A1C of 6.9 and below. So that correlates to an average sugar, typically below 150. So I guess the question is the average 125 and that's just a few finger sticks during the day, or is that the overall average? And then what A1C does that correlate with? We also have to be really cautious to avoid low sugars. So I guess my short version of a very long answer is it's patient specific, but if your overall average is 125, that's a relatively good glucose.
Yeah, I would add on that individuality also, Melissa, with like, what's the patient's age? Are they on medicines that can potentially cause lows? We may, or if they have history of severe lows, there's all sorts of different factors that you and your provider are going to talk about to make a very specific plan.
Thank you both. Someone was asking, how can I get motivated to take care of myself if I am pre-diabetic? So I know a lot of you've all shared some really great resources. Is there anything maybe that might be different, an additional thing to add that someone could do?
Watch the entire little film. I mean, seriously, it's pretty eye-opening when you watch the entire thing and you see, especially the young woman that we watched and her regrets. Like she said, if I could go back in time and would have taken it seriously, you know, she's facing not to mention death, right? She's facing death, but also blindness. The young man that was going to have his foot potentially amputated, etc. It's not fun. That's not a good time, I would say. So to me, that's motivation for sure. But that's a good place to start, is just education in general. And before I was diagnosed, I mean, had no clue. I thought, you know, diabetes is it's like having high cholesterol, same thing. And definitely, yeah, you can have bad outcomes with high cholesterol, but it's just another number you have to track and watch. Just change the way you eat. Don't eat at McDonald's every day. Everything will be okay. I had no idea. And so it is, I think, educating yourself on type 1, type 2, and then the things you can do to help prevent it. And then also family history. When I was diagnosed, I realized, asked my parents, do we have anybody that in our family that had type 1 or any diabetes, and found out, oh yeah, my Aunt Karen did. She passed away in the 50s at age 15, but it died of leukemia. So nobody ever talked about diabetes at all, because that kind of trumped diabetes. Nobody ever talked about it. So also just understanding if you have a family history, I think is important too. Final little thing I forgot to mention, if you, what's really interesting from a type 1 perspective, and I think we have a link for this too, there's some new, it's called T1 Detect. And so on the JDRF site, if you do have a family history of type 1, and again, we have the medical professionals here that can keep me honest, but I think it's something like you have something like a 5% chance, I think. So my kids have a much higher chance of developing type 1 than maybe just the general population. Did I get that right? Medical professionals? Okay, good. And so JDRF has partnered with some different research labs called T1 Detect, where they can check for 3 key markers to see if you're predisposed to having type 1 diabetes. And so you can go onto the site and learn more about it. And I've tested my own kids, and thankfully they don't have any of those markers. So doesn't mean that they won't ever develop it in the future, but it just means the likelihood's lower. And then they're coming out with some new drugs that are pretty exciting, that if they do have those markers, there's some that are being tested now that could even delay the onset of type 1 for up to 3 years. So there's some really exciting research that's underway right now that is good to check out if you have type 1 or know anyone that is.
Wow. Yeah, what a great resource, Rich. Thank you. Someone is asking too, saying, wonderful job, appreciate the film and the conversation. And this is a great question that I had as well. They were asking, how do we get the word out? I think is the percentage like 8 or 9% of the population in Iowa has diabetes. So what stakeholders need to be at the table, or what needs to happen to reduce those rates? Maybe Dr. Pitlick?
Yeah, I'm thinking,
Okay.
as you know, there's a lot of good grassroots programs out there. One that the ADA used to run, and I think there's still some on it, are going into schools and talking to them about type 2 diabetes, and talking to 4th and 5th graders about what it is, and starting young so that they start to learn about health at that age. That's one absolute way. So education is key. One of the things that when we were talking about motivation, I think diabetes educators are wonderful for type 1, type 2 who are needing extra motivation. Part of an education program is setting goals and coming back and working towards those goals. Other stakeholders, I think, just having our doctors, having our educators get out there and talk with everybody. I think, Melissa, your group just did a wonderful program. I got to hear about it. So I thought that was fantastic. And it's just creating awareness. At Iowa Diabetes, I run a blog, and I'm posting about diabetes educational blogs once a week. And they're going out and trying to just continuously get more information out to the public about what's going on, and then getting the information to where it's needed. We've got a lot of good coverage here in Des Moines, but it's out in rural Iowa that especially type 2 diabetes, they're needing additional help and additional resources. So whether we're able to provide different community outreaches to some of those areas as well.
And I love the pre-diabetes. That's like my favorite place to chat with people. I think many people get that diagnosis, and it's not really a diagnosis. It's oh, your blood sugars are a little bit high. We'll just kind of watch it. But that's where I think dietitians, we love to start having those conversations, because it's right at that place where they're kind of borderline with their blood sugars getting higher. And so coming to, again, using us as a free resource to just talk about your health, talk about where you're at with your food, your grocery shopping, just kind of start making some small changes, and they can lead to big rewards with your blood sugars. So
Thank you both. Wonderful. I think we have time for one more question. I'm going to end on a timely question that any of you can chime in. I might maybe start with Rich. Thanksgiving is coming up. So what are your suggestions to eat healthier while still enjoying maybe traditional food?
Oh my goodness. Oh my goodness. My favorite holiday and meal of the entire year. And I love stuffing. That's my favorite. Stuffing and mashed potatoes, right? Are there any carbs in stuffing or mashed potatoes? Just a
Few.
little. So yeah, other than like walking and running, around the block 20 times before I eat, I'm kind of joking about that. But certainly, I mean, for any diabetic, whether you're type 1 or type 2, and especially if you're on insulin, I think dosing before, so it's not again, I'm not giving medical advice at all, but just what I do personally is really watch my numbers even more closely. Because it's amazing. You throw in some cranberry sauce and some stuffing and mashed potatoes. Next thing you know, my numbers would be skyrocketing at that point. So, and then you're potentially chasing them, and that's no fun. That's no fun. And so I think it's just really preparing. But I would say enjoying the food. I'm going to have my stuffing. I'm going to have my mashed potatoes. And so I'm absolutely going to enjoy Thanksgiving. But it's just preparing. Dosing in advance and just kind of doing what you would do, but you can still have fun and enjoy, and even have pumpkin pie too. You can do that too. So I hope the experts agree, because that's what I'm doing, but
That's what you're planning on.
Yeah.
I just had a conversation with one of my patients about this today. He's a type 2, he's just delightful, and he is a chef. And he said, oh my goodness, how do I go into this holiday? What do I do? And so we talked about some healthy swaps that he could make and still enjoy his food. So could you do sweet potatoes instead of a traditional potato? Could you go heavier on the green beans and lighter on the stuffing? Could you do the turkey with a little less gravy? And so making most of your plate healthier choices. And then the things that you do choose that are maybe splurges, just watch portions. Maybe have a half a slice of pie. I don't think any of us want to feel like we're depriving ourselves on, a fun, joyful day, but just moderation.
Perfect advice.
I agree. I always tell my patients, don't skip all your meals the rest of the day and load up at that big meal. Like, still have your same meals during the day. Drink water. And I always recommend having a salad with a vinaigrette dressing before the meal, because that actually could possibly help keep your blood sugars a little bit lower as you eat the rest of the meal. So that's my little tip.
I get to go last. All my tips are gone. So shameless plug, I actually released a blog on this probably like a month and a half ago on like how to enjoy a party. How do you go through a potluck and still do it? One of them was like 1 scoop of every dish, or 1 scoop, and really limit that portion size so that you can still taste some of the good foods. And also doing some of those things that Melissa said is like little swaps. So with, instead of 100% potatoes, mixing in mashed cauliflower with your potatoes, so you decrease your carbs just a little bit and still feel like you're eating those good mashed potatoes. But I have at least one blog, maybe more, on enjoying holiday meals out there.
And how can people find that blog link?
So that's at iowadiabetes.com. And then up at the top, we've got an entire portion devoted to our blogs.
Perfect. Well, some great, wonderful conversation. One person chimed in and said, I've been type 1 for 65 years and haven't continued to have a full life. So that's motivation for doing what's needed. And as Rich said, for Thanksgiving, build in some sinning. So sounds like everyone had some great suggestions on how to make adjustments for still celebrating special holidays. As we wrap up, I just wanted to say thank you all on behalf of Iowa PBS for joining us for this special pop-up film series. And a big thank you to Rich, Dr. Pitlick, Melissa, and Anne for providing great conversation and answering all of the questions from our audience. You can watch the full 2-hour special Blood Sugar Rising for free on the PBS video app or pbs.org. And I hope all of you can join us at future events, both virtually and in person and across the state. And you can find all information about those events at iowapbs.org/events. So thank you everyone so much again, and have a great night.